This is part two of my series called Heart, Health, and Fitness. I want to answer some questions from people who write me who also dealing with heart disease, heart transplant, and heart issues. One of the questions says, how did I get started walking after 2 years unable to walk? What I got me one of those big, tall walkers, and I would walk a couple of houses down the street, one, two house, and every week I pick up another house and start until I start walking the whole block. What also good is that you can walk behind a wheelchair, and you can do the same thing. But when you get tired with the walk and the wheelchair, you can sit down, take your time, and when you have the energy, start back up again. This another question is, I joined a gym. I have heart disease and on a heart transplant list, but the gym owner told me that I need to buy supplements. The gym owner trying to kill you. Pre-workout, amino acid, and creatine is not good for people who have heart issues. Number one, is going to mess with your kidneys, and number two, is going to ramp up your heart. And the reason why I can say this because my stupid ass, start taking amino acid and creatine, and it was messing with my kidneys and in my heart rate, and I was kicked off the heart transplant list for 60 days until all that stuff got out my system. And no, you do not take any type of supplements if you're on a heart transplant list. No pre-workout, no amino acid, no creatine. The stuff will kill you, especially no energy drinks. Stay away from anything that's going to ramp up your heart. It's not good and it's not healthy. One lady said, I have no energy to work out. How do you do it? This is two factors. Number one, you're probably not eating. When you work out, you have to eat. In it, food is like gasoline to the body. You got to eat. You got to take more than protein drinks. And I know, when you're on a heart transplant list, you have a heart disease. We have a habit of just sitting around, waiting for a phone call, and thinking, why me, Lord? Why this happened to me? Well, we need to start getting active. Not being active, you lose a lot of endurance, and you lose a lot of strength in your muscles and a lot of tone. So you got to work back up very slowly. Very slowly work yourself back up. When I first went to the gym, I couldn't ride the bike for 5 minutes. I couldn't do one push-up. I could only bench press 25 pounds. Now I ride the bike for an hour. I can do full sets of 25 push-ups, and I'm benching over 300 pounds. But it didn't start like that. I had to work my way up, and it took me a while. But you gotta eat. Eating is very important to the body. And the next question is, when I'm active, I feel like I'm about to pass out. I'm in the same boat. I got rushed to the hospital 10, 15 times from passing out. I'll be in the garage, I pass out. I'll be in the backyard, pass out. And what it was, I was dehydrated. When you have a heart disease, they put you on a liquid diet and how much you can drink and stuff like that. And we do it, but we dehydrate ourselves. And when the body doesn't have any water, not no Gatorade, not no coffee, not no soda, water, it makes you pass out. And so a lot of people, they pass out when they have heart disease because they're dehydrated. It's very important. If you're going to work out, drink water and make sure you eat. An hour before I go to the gym, I eat my breakfast and I drink a bottle of water before I go to the gym, and I drink another bottle of water when I'm halfway through my workout. I haven't passed out. Everything looks good. So keep sending your questions and I'll answer them for you. But I'm gonna keep doing these videos to help help people in the same boat as I am.